Lilly Diabetes and the Lilly Alliance have a number of disclosures, more than 60 at this meeting. A few highlighted disclosures that we think are key. The first is the so-called Mosaic study, which is a large observational trial looking at insulin intensification or intensification of therapy in patients with type 2 diabetes. This has been an ongoing trial where we've looked not at specific therapies, but really at the components of behavior and interaction between the patient with diabetes and their provider. And at this meeting, we're presenting not only the primary results of that, but some of the analyses from those primary results. And what this study has demonstrated is something I think we all believed we understood, which is the importance of the relationship between the patient and provider as key to helping us look at changes in therapy when they may be beneficial. While this may seem obvious in clinical practice, certainly understanding the components that contribute to the best patient-provider relationship when therapy changes may be necessary is critical, not just to Lilly Diabetes and the Alliance, but to the care of patients with diabetes. The vast majority, like the population, will focus on type 2 diabetes. We have data on our dulaglutide Trulicity compound, which is indicated for type 2 diabetes, empagliflozin or Jardiance, which is used in type 2 diabetes, although under investigation in patients with type 1 diabetes, but then our insulin franchise and our disease state focusing on both. So I would say the majority pertinent to type 2 diabetes, but covering, we hope, all the needs of patients with diabetes. The burden is greatest on a population basis for type 2, but type 1 diabetes is a lifelong disease and affects people over literally decades. So we believe that the care of all patients with diabetes is really key. The last would be something I've mentioned earlier, and that's the data that we have here on empagliflozin and its outcomes trial. Not only looking across populations, young, old, those with and without high blood pressure, various ranges of things like cholesterol, where the effects of empagliflozin, Jardiance, across those populations appear to be consistent. So regardless of your background, the observations reported last year in the New England Journal of Medicine seem to be consistent across those populations. And then novel data that we'll be presenting here on Tuesday of the meeting is specific to protection from changes in kidney disease. So those two things are additionally things that we would highlight at this meeting. With both the number of disclosures, the size of this meeting, and the scientific information that's being exchanged, Lilly Diabetes and the Lilly Alliance, we're proud to offer a very broad range of options or therapies for patients with diabetes, but to do so in light of Mosaic with consistent support for those treatments, and to do so understanding what the patient's needs are. That having just one approach to therapy and not understanding the critical importance of support, we know has proved in many cases less successful, and to understand that for many patients, as you suggested earlier, where time may be a limitation, that simplicity and ease of use or approach will be critical. I think all of those messages are part of what we have embraced at Lilly Diabetes and what we're using to move forward. So are we where we want to be? Yes. We're in the diabetes space. We're committed to it. We have been for 93 years, and we hope to be for decades to come. I think this harkens back to that broad range of therapies. If therapies A and B work best for a population of patients, and we can participate in that conversation because we manufacture and understand the nature of those medications, all the better. But if in fact it's A and C, or A and D, or D and F, again, I won't say that we can remain agnostic to treatment choices, but we can participate across the spectrum in scientific and clinical conversations to bring more data forward. That allows us, not to necessarily say this is the right approach, but participate in all those discussions.